Okay, today's presentation is going to be on cerebrospinal fluid, or CSF. It's presented by Tasha Mack, Lupe Gallo, Wendy Wiki, and Nicole Castleman.
What is CSF? CSF is a clear, colorless alkaline fluid surrounding the brain and spinal cord. It is synthesized by the ependymal cells that line the ventricles of the brain, or it is clustered within the choroid plexus. CSF is absorbed mainly through the subarachnoid space into the dural venous sinuses, aka the ventricles, where it joins the blood circulation at the internal jugular veins. This is a sagittal view of the brain showing the cerebrospinal fluid flow. So why is CSF important? It is important for protection, nourishment, waste removal, and it acts as a reservoir. The CSF acts as a cushion around the brain, which absorbs shock in order to prevent damage. The CSF provides nutrients to the brain. It normally contains low protein, moderately high glucose, and no to very few cells, varying amounts of sodium, potassium, chloride, magnesium, and iron. The CSF is responsible for removing waste from the brain. CSF is reabsorbed through arachnoid villi that line the blood vessels in the subarachnoid space. CSF is a fluid reservoir for blood and maintains a uniform pressure around the brain. This is a coronal view of the brain.
Okay, now we're going to talk about some CSF abnormalities, such as meningitis and hydrocephalus. In meningitis, to diagnose, it's obtained through a lumbar puncture in order to evaluate the CSF to determine if a patient has meningitis. Evaluation of CSF can also help differentiate between viral and bacterial meningitis. In viral meningitis, it's a milder disease, more frequent than bacterial. Most often occurs in ages less than 5 years old, commonly due to enteroviruses. And the CSF is clear in color, normal glucose, and normal or high protein. In bacterial meningitis, it's a serious disease that can result in brain damage or death. It's truly a medical emergency. Typically, the CSF is yellow in appearance, has low glucose, and high protein. The signs and symptoms of meningitis include fever, chills, mental status changes, nausea, vomiting, severe headache, and stiff neck. Alright, the next disorder is hydrocephalus, a condition in which there is either an overproduction of CSF or blockage of its continuous flow around the brain and spinal cord. This causes a dangerous buildup of CSF, which puts potentially damaging pressure on the brain. Symptoms include bulging frontally in young children, sunsetting eyes, headaches, vomiting, seizures. To diagnose, you need a CT scan of the head. Treatment includes surgery to remove blockage. If not possible, a shunt can be inserted into the brain to reroute the flow of the CSF. And here are our sources that we used.